The date today is December 4th. We're at OEK Satellite office, and it's a pleasure to have you come. I know you were doing something else, and we just took you off your schedule, so we apologize for that. And so if I may have the President of the Republic, His Excellency, kind of introduce you so that the senators will know, and then he can leave, and then we'll have the discussion, and then habang yung President.
Hindi ko alto bela. Okay. Mada malungil Nita Sils. Congratulations. Mora senators re-elect o sengo. Di kita marunong artiang kita madalo ase kadang release la hospital authority. Makatatal do sigara adal mo adal abor del nombralo asensil help pergidara awal telurior. Umlari se ngaramom naringel redir saibal mle CEO del hospital saibal mle udaswado ase dungul mo adal abor der gidel goram skit segidel perspective. Di kita namne senator sang gerdi namno dal seben. Mong tiam nombre kat sewado. Kita kasi tuwa di ulakral. Ya kara gilesya orang serenggal no kapitan Mr. Wells amle student missionary amle sensei ra skura sewado ngarte ara 1993. 92-93 school year. So our students niya Marcy Olgari, nama Klenda Nirmeri, nama Clarence ra Kitalo, Omdas Uegi. Tiga amle students niya. Tiga ko amle arrange ra omrolen merbelan me holding le ungar artial children's story mga mawais ra story niya. Tok lo orang sini yang mamsado ra se. Yang ko ungar lo hospital ra Blura California. Just so happens ungar la 8 el hospital, 127 clinics. Mengomrega mauriulak mitringira temlera blimam Mr. Jesus makase kalel ko se manam dasura ngare auriol gi mo sigara adlo aseng ase el monil ora di help la advice rakamam mundilo lo ase oya aurera kar se sel melom seng a club sertiang sel bol melom sertiang club ser se adi will idera al conflict ay gidel teme gal auror nga kongel el long ser komyo. So, wal seguida wal gora miskit serutas ase taskri ngilnge mang agim le askri ra seragot tulura se medamit trial adra adori tirela no se mesa doctor Roberts ma doctor Dever temle mitri gora uldas ase da submit tranquil mandimle eli agirulis el babilingel الابوينتمنت لغون مقبل من غسولي المال دي مريض البايقول راهيري نغار بيلاو الغاقيد المرال تي عديم لي امرال من ميلي ربيلاو المراني عملي سوالو تترغن لغيل مسا بيلاو يدريق الانكوريتش رغن لغيل رسيب مشونالي من ربيلاو so رغن لغيل اوك نامور سيل تنغانا هاي سكول hopefully there'll be missionaries here. With that, this is Mr. Jason Wells, SM in Palau from 92 to 93. And first of all, Jason, thank you for volunteering to be a member of the hospital authority. And I'll turn you over to Dr. Cuarte and Senator Cuarte and all the senators for questioning. But yeah, Sula.
So haledilia President Malora let me, Mr. Wells, take an opportunity to introduce the senators who are here today, and then I'll give you the microphone to tell us a little bit about you. So with us is the President of the Senate, Senator Baules, and to my left is Vice President of the Senate, Senator Mariur, and to his left is the only lady senator, Senator Inabo. And to my right is Vice Chairman of the Committee on Health and Social Welfare. And then we have Senator Tabalwal. We have Senator Talams, Senator Sungino, Senator Mangsao, and on the other side is Senator Basilius. Now, if I may just kind of shortly brief you on the process. So I had an opportunity to talk to the other board members, and so we kind of have what they said. And so this is just to formally have a conversation with you so that the committee can actually put a report together on this resolution, and then we'll present it to the General Senate for election. So with that, let me give you the microphone to introduce yourself and tell us a little bit about yourself.
Thank you, Will. It's an honor to be here with each of you, and Palau has a very special place in my heart. It was a transformative year for me, and 32 years ago, but those 9 months here were priceless. And the kids that I got to work with, and they touched my life, and I hope I touched theirs. And to see Marcy teaching in the same school, to see Mondasu and Phaedra and Glinda Tao thriving and doing so well at Roland and Clarence, it makes me proud. Really good kids. But Senators, it's an honor to be with you. I lead 8 hospitals in California. We are from Fresno to Bakersfield. It's about 220 square miles. We care for over 1.2 million patients a year. There's 127 clinics that help support the health care. We obviously want to keep people healthy and out of hospitals, but the hospitals are there when people do need to stay the night. We have emergency departments and surgery and many of the things that we have here. We have about 7,500 employees between our hospitals and our clinics. I'm the president of the network of hospitals there, and our medical staff, we have 37 different specialties that we cover. We try to do everything we can in Central California, but sometimes patients will need to go to Los Angeles for a higher level of care, similar to here in Palau. But it's things like liver transplants, heart transplants, pretty much everything else we can do within our network. We do open heart surgery, we do neurosurgery, all the complex tertiary quaternary care. We do telemedicine very well, and our strategy is keep patients close to home when we can, but I have 25-bed hospitals, I have 40-bed hospitals, I have 300-bed hospitals, and so if we can keep someone in their small community like Tehachapi, California, where we have just 25 beds, we do that, but sometimes they need to come to Bakersfield for a higher level of care, much like Koror experiences here with people needing to go to Taiwan or Guam for other things. But I've been in healthcare for almost 20 years, and after I left Palau, I finished my education, my undergrad, and then I taught for 9 years. And I was a high school history, English, and music teacher. Palau inspired that, and went back and got my master's in business administration, and then I got into healthcare, and I got into patient experience, and then running clinics, and then running hospitals, and been successful. I had a chance to tour the hospital yesterday, and had a great experience meeting many of the people as we toured the med-surg, we toured surgery, OB unit, the PT unit, and went through the ED. I was a patient in the emergency department back in 1992 when I cut my foot on a clamshell out in the islands, and they did a great job. So I'm here today. But yeah, it's an honor to be with you today.
Thank you. There's a questionnaire that we always give to people. I'm not going to ask you the details, but just need to kind of have some comments on some of these questions. One is you do acknowledge that the President of the Republic, His Excellency, actually submitted your name to the Senate for advice and consent.
I do acknowledge that, yes.
Okay. And do you have any medical issues that might prevent you from fulfilling this duty?
I do not have any medical issues that would prevent me.
Is there any business deals in Palau or that might present a conflict of interest?
No conflict of interest. I don't have any business dealings with anyone from Palau or any other than being a tourist several times and wanting to bring my family many times.
Okay. The Palau Constitution actually has two provisions. The first provision is in Article 6 that talks about providing services, so disease management. In 2005, it was amended, and then preventive health became a fundamental right of Palawan citizens in Article 4. So this separation of hospital from the Ministry of Health is so that secondary and tertiary care can be done according to Article 6, disease control. And then probably Ministry of Health would then actually implement Article 4, which is preventive health as a fundamental right of citizens. Do you see that as a viable strategy going forward? And we will provide you the copy of the law when you leave today.
Thank you. I think that any investment in preventative medicine is a good strategy, and so making sure that we have over-resourced, not under-resourced, keeping people well, and so they don't need hospitalization. Hopefully, we realize that's a part of life, and so there will always be emergencies, surgeries, end-of-life care that is needed. But investing heavily in prevention is a great strategy. And so if the separation of the two helps strengthen the clinic structure and the preventative care, that is a good thing. And for my network, what subsidizes the hospitals is the very clinic structure in America. So we get paid well for the clinic visits. We don't get paid well for the hospital visits. And so we would need to make sure the business model here in Palau keeps the hospital healthy financially. I think that there's some opportunities for the hospital just right out of the gate. I had a chance to tour the physical therapy department yesterday, and great people there. There were 8 people on staff, physical therapists, associate physical therapists, sports therapists, beautiful facility. I mean, state-of-the-art beds and equipment. It was excellent. I asked the leader, Jason, I said, how many patients will you see today, both inpatient from the hospital and outpatient? He shared they expected to see about 10. Economically, that doesn't work. I mean, you can't have 8 team members caring for 10 patients. If we had eight team members on in the States, we would expect them to see about 10 to 1. We would need about 80 patients to make the economics of that day work. So there's opportunities around. Now, if it's a strategy, one beautiful thing about Palau is you don't see any homeless people. We have tons of homeless people in California. So if it's a strategy to give people jobs, then that's great, and that's part of the strategy. But if it's a strategy to run a business, the hospital does need to be run a little more efficiently, and there's plenty of physical therapy needs, I'm sure, in Koror and the surrounding islands. We just need to get them into the hospital and help. We've got a great team. We're just not making the connection to get people into therapy.
Thank you. You mentioned telehealth. What do you think will be the role of telehealth in terms of this separation from both administrative expertise? Let's say we don't have any financial capacity on the ground. Could technology be able to be done using that modality without somebody being on island?
Yes. So how we run our network with 8 hospitals, I could not afford to have cardiologists and urologists and endocrinologists at every hospital of the 8, but I can afford to have them at 1 or 2. And so they are able to telemedicine in to my smaller hospitals and give the advice. So much of the data, as physicians, as you know, you see the medical record, you understand what the patient presents with, and then you can make a decision based on that. That can be done remotely without hands-on 80-90% of the time. And so it would allow us to have cardiology coverage here, urology coverage here, nephrology for kidneys, a lot of the specialists that we may not be able to afford to have in a country our size, but yet we can have them through telemedicine. So whether it's a Taiwan partnership, a Japan partnership, a Guam, a United States, this team needs to figure out those strategic partnerships to make sure that we have the highest level of care for telemedicine.
With that opening, President, already ako question Raulal open Raulal. I'm going to have anybody who might have a query. Just to let you know, I was a medical director for Family Health Plan, FHP, in Southern California, in Inland Empire.
That's where I was born, at Loma
Yeah.
Linda. Excellent. In San Bernardino area?
That's where I train.
Oh, excellent, Doctor.
Good afternoon,
Hi
Mr.
there.
Wells.
Thank you.
Thank you for your story on Sabbath and
Thank you, Senator.
the Bell's Choir that's you showed on the screen. It was very nice story, and thank you for coming back to visit us. Actually, we are here to know more about you and to be confident that you can and would be available to help us with this transition. And based on what you know about the medical services that we have here and the way that it's run where everything is put together, we heard from another candidate. I mean, we have approved the nomination in the hearing day before yesterday. She said that the process of separating the hospital from the clinical and other health services would be not difficult, but maybe takes a lot of details and sorting out the people and the offices and the money and the grants. What do you see? How do you see us moving in that direction? That's my number one question. My second question is about your experience in appointing a hospital administrator, and compare that to the position you have. What kind of position do you have? And is that considered hospital administration? And based on that, what would be your recommendation for hiring a hospital administrator to oversee this process of separation? Thank you.
Thank you, you bet. I'll work backwards. I have been a hospital CEO of a 25-bed hospital, all the way to over a 250-bed hospital. Today, I'm the president of all 8 hospitals, and so I'm the only CEO of record of all 8. And so it's a new strategy we're trying, but I have hired previously in my career individual hospital presidents that have reported to me. And so I do have point people on every campus. It's not the title of president, but they are the most senior administrator of the 8, and they all do directly report. So I think the administrator that we hire, culture to me is probably my biggest passion in healthcare. I sensed there were 200 to 300, if not 400 team members at the hospital yesterday. Great facility team members, clinicians. Those people need to know that their job is a calling. It's not just a job. I mean, they need to know their why and a deep sense of purpose. So a hospital administrator that starts the day, ends the day, would do every single thing that they would ask somebody else to do. A servant leader, that's who I would want to make sure we hire for that role, of somebody who high transparency, high accountability, and just creates a deep sense of culture. And so I think that make it the place that where people want to work, that they love being there, and they have a deep calling. I think that's important. The separation of the clinic, the clinic side versus the hospital side, I am sure there are other entities that have done that. That would be one of the first things I think the board should take a look at is, if Guam's been through that, if Saipan's been if somebody else has been through that, let's learn what worked well and what didn't work well, and try not to repeat those things. As that process goes through, it's going to be essential to make sure that both are built to succeed. And so the hospital has to be able to thrive without some of the grants and other things that maybe have come to the big bucket. And if we're going to separate it, It just has to be a path for the hospital. And so is my role in the hospital board. I would be, I have a deep sense of the business of how to make hospitals work economically and making sure that we're built for success, that we can, 5 years from now, be thriving as a separate entity. Even though they feel different, in the American system, the FQHCs, the federally qualified health centers, they are separate from hospitals, but hospitals have been able to open up clinics under, we have, of the 120 clinics, 50 of them are rural health clinics, and there's a different reimbursement for that. And so it may be down the road that the hospital needs to have some clinics that don't necessarily compete, but also are working to keep people healthy. But that is a strategy that we would need to take on with you as senators and make sure that that economically works. But our hospitals have clinics as well, because our strategy has been keep people out of our emergency departments. It's a very expensive place to provide care, and far too many people in California just use the emergency department for their health care. And so we need them in clinics, not in the ED, and save the emergency department for emergencies. But the first step will be, finding a healthy way to separate the two and navigate that and make sure that we are tapping into all the resources possible to let the hospital thrive. And it's a challenge in America, and I'm sure it will be a challenge here, because the reimbursement, healthcare is so expensive, especially in a hospital setting, and the reimbursement often doesn't match the expense to provide that type of care. But I think there's opportunities. Yesterday, as I toured the dialysis unit, they shared that about 50 patients will get dialysis, but we're only able to do dialysis twice a week. As you know, 3 times a week is probably the standard of care for many patients with dialysis needs, but we have too many patients with not enough resources, and there are small dialysis units now that we've deployed to all of our hospitals, and we've even deployed them to the home, and they have all the necessary chemicals inside for dialysis right inside this little box. And if you've toured it in a hospital, you know the room, and it's just not standard of care that we would want to have. So I think there's some things that we can do with minimal investment to get Palau the care that it needs and to get dialysis 3 times a week and not the 2 times. But again, to your question on the separation, it just needs to be done transparently. It needs to be done with as many people in the canoe as possible, so we're all aware of this decision likely will yield this result, and this decision will likely yield that result. Yeah.
Thank you. One more question, and then I'm reading your resume, and it says you have a proven track record of operational excellence with high EQ. It's not IQ, it's EQ.
It is EQ.
Yes. So can you explain that a little bit, and also tell us how are you gonna work with the board here from elsewhere,
Yeah.
from the United States?
Yeah.
Thank you.
You bet. So EQ, IQ, and EQ. For me, EQ is emotional intelligence. And so working with physicians, too many hospital administrators, the only time they lean in and have a conversation with physicians is bad news. Either you can't get this piece of equipment, or you only saw 10 patients yesterday and that doesn't economically work, or it's a negative. And so you have to have, I like to say 10 positive conversations before you ever have a difficult conversation. And I think that's a gift that I have had throughout my career, is making sure there's far more positive conversations than constructive ones where we need to tweak and readjust and have a more difficult conversation. And so, and it goes with every team member, rounding a lot and being present on the unit and showing up at 2 a.m. and, bringing treats for all the nurses and just, why are you here, Mr. Wells? And well, you're here, and it's just being that type of a leader is high EQ. I'm not the smartest person in the room, but I do think that often as hospital administrators, we could do better on EQ. And so that's been a passion of mine. And then your question on how can I do it from California, from a time standpoint, I think Zoom will be helpful because I won't be in the middle of my day and needing to step away from the hospitals that I'm leading. So I will have the ability to connect and work in a Zoom setting, as needed. Obviously, if there's a chance to be present from time to time, would certainly be willing to do that. But I think Zoom is going to work well, and with the time difference of 17 hours, it's nice. It really will almost never conflict with my daytime job, and I can do it in the evenings or early mornings before work. Yeah.
Thank you for accepting the nomination
Thank
from
you.
the President.
Yeah, what all
Sorry, Chair. First of all, Mr. Wells, let me first of all recognize and thank you for 32 years ago as a missionary teacher. And I think you mentioned that was the transformative year for you. And the whole idea behind this separation of hospital and public health is also an idea of transformation to where how can we improve our hospital services, but more important, how can we do our public health where we do more prevention? Because that's where the chairman has been consistent and said we need to do better public health, better prevention. That's the key to our health. And then the hospital will be there to pick us up. So that's the whole idea. And I think from what you've been sharing, it shine light on a positive way where we can probably do better. You've shared a few points. So I'm quite positive that from your experience and the points that you share really highlight areas where you can actually improve and do better. And that's the whole idea of why we're sitting here. And I like the idea of the culture building that has to happen. I'm a believer in that. That's the hardest part, but if it's done, it's going to be better. Can you please expand on the servant leader that you shared? I'd like to hear that.
Absolutely. I think that I would want to find leaders for every department of the hospital that are true servant leaders. And so they are ones that will show up early, they will stay late, they will not sit in an office and send a bunch of emails. They will be out with their teams, building culture, answering phones, rooming patients. I'm not a clinician myself, but when our emergency department at one of my hospitals that I'm visiting is absolutely crazy, I can help by turning over beds, by wiping down rooms. And it goes a long way when people see the CEO doing things like that. It just elevates the entire culture. And so that's what I'm looking for from a servant leader. Every hospital I've gotten to, when I've shown up, there have been signs that say parking for the CEO. And it's always the first thing I do is remove those signs. And I park in the farthest parking place because I'm not a physician. I would want a physician to have that first. But it's just an administrator does not need that. And I don't need my own parking place. And it doesn't send the right message when I think I'm better than. And so when that's an example of servant leadership I try to over communicate with my team. Again, there's 7,300 people that roll up through me. And so, to send a Thanksgiving email and just thanking them, we round with different things at odd times of the day so people feel surprised and just say thank you for being here. And as you know, our hospitals run 24/7. There'll be a team working Christmas morning. And so what can we do to make that special? Because they're not home with their families, they're there at the hospital. And so that's all part of that servant leadership is, it would only take an hour and a half to round and cover every department at the hospital. And then I could still be home at Christmas morning. Our administrator could still be home at Christmas morning, but yet they spent 90 minutes loving on the team. That goes a long way. And so those are the things that I would say for servant leadership. Yeah.
Thank you for that. That is certainly something that we do actually need.
Yeah.
Thank you for that.
You bet.
Senator Mangsang.
Sulache, welcome back home.
Thank you.
Mr.
It's good to be
Wells.
here.
Well, in the Mr. President's, His Excellency, when he was introducing you, he said in Palawan that this was not in the plan, but things happen for a reason. And here you are sitting here today, being considered to be one of the administrators. And again, thank you for accepting the. He said he asked you and you accepted. And in your CV, I also noticed that a lot of these people, these CEOs of these big companies, also did the same thing. They came to you and they asked you, and you said, yes, I'm up for the challenge. And so he mentioned servant leader, and I also noticed that you carefully choose the words that you use in this CV. You highlight the words listen. You highlight the words consumer focused. You highlight the words inclusion. You highlight the words community-based. And I think it just says a lot about you and what you just shared about not wanting to be high on a pedestal and saying I'm this big shot. I don't need to have my own parking space. I'm just like the rest of you. That says a lot about you, and I commend you for that. And I love you for being so humble. So thank you.
I'm honored to be considered.
Yeah.
Thank you.
And I chair the committee of technology and cybersecurity. And so what really caught my eye was one of the things you stated was you drove the strategy to shift Adventist Health to be a consumer-focused, digital-forward company that is intentional about removing friction from the experiences of care teams, partners, patients, and families. Could you please just expound a little bit more about that?
Absolutely. So one thing we started doing when I was in the chief consumer officer role for the company was started using this. And so every patient that comes to Adventist Health has a cell phone, and like 99% they're smartphones. So we started requiring cell phones at registration. It allowed us to text message patients reminders that, hey, we haven't seen you in 18 months. We're concerned. Click here to schedule an appointment with any of our physicians. And they could just click on a link, they could see a calendar, and they could pick the 10 a.m. appointment or the 12 or whatever day worked. We would send messages, hey, you haven't had your colonoscopy yet. You're 50 years old. Click here to schedule. You haven't had your mammogram. And so we drove hundreds of thousands of care opportunities by using the cell phone because everyone already had it, and we would pull people into care as opposed to just waiting for them to call us. Economically, it was a good strategy, but more importantly, we saved people's lives. We found cancers that they wouldn't have found, whether it was colon cancer, whether it's breast cancer. And so when I think of a digital forward, it's using technology that's already in people's hands. All of us have probably flown on United, and how easy, your bag exactly where it's at, and you can click in, check in online, and we've got to be better in healthcare. And so we're leaning into different tools that certainly Palau would have access to as well, that patients can see their loved one in surgery and know that where they are in the process. They can see what the wait time is in the emergency department. They can schedule a primary care visit. They can schedule their imaging appointment when their doctor says, we need to do an MRI on that. They can go in and pick a time. And those are consumer tools that have created more access to people. And certainly in the States, healthcare has been, it's not been the most consumer-friendly industry. Doctors tend to do things to patients as opposed to with them. And so how can we give people the education? How can we do video chats with family members so grandma doesn't need to go through her doctor visit alone? She can have, her daughter in Seattle a part of the visit. And so those consumer tools we've been bringing to healthcare to try to take some of the fear out and make it easier to create access. You bet.
Good afternoon, and thank you for
Thank you.
coming. And I have no question, but the way I listen to you, you give me an idea that our hospital need a lot of work. Our management in the hospital here need a lot of management. They need to be trained what to do. So I don't know, maybe Senator Cuarte or the senator think about the how to improve our hospital here. Because the way I listen to you, I wish you here to manage this hospital to make improvement good for the people. Because we have a lot of people here need help. And then we don't get help from the big hospital. So there are 3 clinics. You can see if you go to those 3 clinics every day, there are more patients in those clinics than the big hospital. And that shows that the management of our clinics are doing better than the big hospital. So when you sit there and say a lot of things, I wish what you said and the way you look at it will be done in our big hospital. So I thank you for accepting that nomination to be the member of that board authority. So I hope our future hospital can pick up what you said and pick up what need to be done to our hospital for management, and also because it doesn't make sense we bring the people to come here and work there without equipment, without nothing. There's nothing to be provided for them to use to look at the patient. So I thank you for accepting the nomination, and I hope you can help us while you can help. So I thank you very much, and it's not good to say this, but the way you say a lot of things, those things I wish somebody in our big hospital will do much more better, so people here will be satisfied. So I thank you for accepting that nomination to be the member of the board. We really need a lot of help. I can say maybe we need a 100% renovation to our big hospital. And I'm saying it to you really in my heart, because I see a lot of people in Palau, they really need a good Medicare, you know. We really need that. So thank you for accepting that nomination, and we need really your expertise to improve what gonna be our future hospital. Thank you.
Thank you. I want to give you confidence that there are many very good people at the hospital. They do need to be led. But I met a lot of people that I have confidence in, and I'm honored to have the opportunity to contribute time to this project. And you have my commitment that we will build the team necessary to get that hospital exactly where it's been. I have had the opportunity to go into hospitals in this country, in America, that were even farther behind than where our hospital here is, and turned it around. One hospital specifically in North Carolina, after 4 years, was the #1 hospital from patient experience. We beat Duke. Duke had been #1 for about 10 years. Our little hospital was on the cover of the North Carolina Business Journal for being the #1 willingness to recommend patient experience hospital in the state of North Carolina. So we can do it, and it's just a philosophy, and it's a culture change, and it's making sure everyone brings their best, and we will hire the team, and I'll work with the other board members to just make sure Palau gets the very best. You have my commitment.
Well, Mr. Wells, thank you very much. Running, I used to stay in Shelburne, Indiana, probably the size of Palau, and they send people to Indianapolis. But there was no sense of isolation as we feel while we're here in Palau, because the next available way out might be the 2-3 days from now. But in the sense, when you say, what's the word? Servant. What was the word?
Servant leader, yeah.
Servant leader. There is a sense of kind of a spiritual connection to it. and I can understand that. But for those of us who have been struggling with the health sector for a while, and the separation of preventive health as a fundamental right, the debate that we want to see is it's really a economic balance seat. There are many people here. I'm sorry, that's floor leader Senator Cecilia who came in late. There's Senator Inabo. There's Senator Mariur who knows numbers. Many of these people know numbers better than I do. So they know that there's a savings, and there's assets, and there's liability. And so the strategy was to actually address the liability, the disease side, to start with controlling the liability side so we don't spend that much money in order for us to then build the savings capacity. And that's why the strategy to deal with off-island medical referral, the hospital now, so that we can actually then build the assets. I just want you to know that as you talk about this servant leadership, that in a sense of moving the health sector from where the hospital was the most sexiest place that people think we can go to ER and actually then find help there. I think Palau is moving away from saying, no, that's to control the spending. By doing this authority, we are actually trying to control spending so we can then put our effort in building the assets. So I want you to know that that's really kind of the direction that generally Palau aspires to go. So with that, with that, Senator Singino.
Sulang Chairman good afternoon. No, I wanted to hold my tongue, but when I was listening to you speaking, I just wanted to say something. Because the words that you were saying are similar to my background in sports, as I was a coach. So it's the similarity is there that you motivate and encourage a team to be more proactive and produce more results that are owned by the team. The coach is just there to guide and help the team. But the owners of winning and losing is the players. And the principles are the same when you're discussing about your background and how you came to be and what you stand for in terms of trying to lead a certain group into achieving their goals. So I thank you for that. It's similar to what I understand of a leadership, a servant leadership. Because what you said is pretty much what I understand in terms of the sports side of being an athlete. So I was listening to it, I was watching my phone trying to figure out who is the coach. Chan Wooden would be the principal coach I would compare you to. And he's one of the best coaches in sports.
Very generous. Thank you. I'll just close with a comment on that. I ask people often to be CEO of their own world. And so I'll talk to the young lady who runs our emergency department at our biggest hospital, and I'll say, Tracy, I need you to be CEO of your own world. This is your domain. And you know best, you're closest to the action now. I'll always get in the canoe with you. If you need me to be a part of a decision, I'll own it with you, but I empower you to make the best decision with the information you have, and you don't have to always run it up the food chain. Like, I'm gonna empower you to lead. Now, you're gonna be held accountable to your performance, but you've got this. And the culture, people love it because there's no one to blame. They can't blame administration because they are administration. So it's just like coaching. The players on the field, they own winning or losing, and you empower them, but yet you motivate them and inspire them. So it's a partnership. Thank you for sharing that.
Senator Talams.
Sulang Chairman. Thank you, Mr. Wells. Thank you for visiting Palau and accepting this nomination by our president to be one of the board of directors of our hospital authority. I read your track record yesterday, and I was ready to vote for you to become a board member. Our president, the Senate president, introduced a resolution confirming you to be one of the 5 members. And reading at your track record and listening to you now, I'm convinced that not only doctors can run the hospitals. You can be not a doctor and can be a good leader in a managing team in the hospitals. And many people are not satisfied with our hospital the way it is managed. And I feel many Palauans they want to have a more improved patient experience and satisfaction in our hospitals and health services. And listening to you and reading your background, it's going to be a great help for Palau. And I feel with your background and what you said earlier, that you were in Palau 32 years ago, I feel you're part of our island, part of our community. And I'm glad you had a chance to meet with our hospital workers so you can see, you can hear from them what they need and how they feel about the management and how they run the hospital and provide the services that the Palauan people really need. So I really want to thank you for that and for accepting the nomination. And I hope you not only communicate on a Zoom, but you can visit sometimes. Because if you visit personally, I know by talking to our team here, they will be more inspired, especially with the spiritual, humbleness that you possess, and maybe you can, relate it to our workers, and that really help our people. So I thank you for that.
Thank you, Senator.
Mr. Wells, thank you very much. I'm going to give you the mic to say your last words, and then I'll have the Vice Chairman of the committee to close our hearing.
Thank you again, Senators. I so much appreciate the opportunity, that your confidence in my leadership. You have my commitment to be a part of the team and build a consensus team with the 5 of us, that we will work together and find a path and keep you all well informed of the progress that we're making. And success for me looks like a couple years from now that people would never want to go elsewhere for their health care, that they feel very proud of the care that they get right here at home. And the resources that we're paying other countries today to take care of Palauans stay right here. Because the bills that we're paying other countries, well, we appreciate that partnership and that care. If those dollars can stay here, that's a better strategy. Best strategy of all is keeping people healthy. And so I fully support the strategy to invest in preventative health and minimize the need for hospitalization by getting ahead of things well before someone needs to be hospitalized. But when they do need to be hospitalized, that people have the courage to trust us, that they are going to get the very best care, and they're going to be connected to doctors from around the world through telemedicine, and they don't have to fly to Los Angeles or fly to, Taiwan. They can be cared for right here with the same level of decision-making and science and medical excellence as we use best practices at the hospital here. So thank you for your confidence, and I'm looking forward to a celebration in a couple years when we get this exactly right.
Well, I say, Mr. Wells, on behalf of the committee, let me first say that, as the President has said, teolakral, meaning that your decision to be here 32 years ago enabled everything to happen, and that's why we're here today. And how you made that decision, we thank you for that decision. And I think you feel the enthusiasm in the room, a sense of optimism, and the celebration that you talk about. It is our hope that there are children that will celebrate the health that we are trying to accomplish. And we are hopeful that come next year, when you are part of the board, that you'll be instrumental in that development. It is our hope and that of our children. And you want to rest up with you. I know it's a heavy calling, but it needs to be done. And that's something that we ask of you. If it happens that you are part of the board, then you be the instrument to make those changes along with the members of the board. It has to happen. And Palau relies on the health of their children. And we want to thank you for accepting the nomination, and we are looking forward to working with you and making those improvements. Thank you so much. Itiaya di mertiang orokyo tial hiring ergit, ya koman sulal neral al trial chits.